I've been lucky enough to work with GICS on several projects. In particular, I started working on the Rapid Access Lung Lesion Clinic. That started in 2017 and has made a huge impact to me and also the health service in particular. And more recently, I've done work with Symphonia, looking at priorities within the care of lung cancer and also looking at the hospital's response to the National Lung Cancer Screening Program. One of our greatest, or the greatest success, I think, has been establishment of the Rapid Access Lung Lesion Clinic. It was established because they identified that patients within the region who had a diagnosis of lung cancer weren't meeting the optimal care pathway guidelines, essentially. And after a whole lot of work they did with GICS, with stakeholders, they established or they worked out that they needed a clinic that was multidisciplinary and had a really innovative approach to managing these patients. Prior to that, patients came into the hospital multiple ways, and a lot of times they were sort of like in silos, I would describe them as. So patients might be in one clinic and another clinic, but it was often really hard for those clinics to talk to each other. So bring the stakeholders together. They actually said, what would work really well is a clinic where we're all there, same time, same place, and setting up a model that meant that they could talk to each other at the same time, but also work collaboratively. And that's what RALLC was. We've now been able to go on and look at the prioritisation for lung cancer and where we need to go next. And with the rollout of the National Lung Cancer Screening Program from July 1st this year, that's actually going to change the landscape again. And we're in a great position already to adapt to that. And we're probably light years ahead of lots of other health services. I think change is always hard. And when we first established RALLC, it was a really different mindset for clinicians. We were really lucky. They were always very engaged from the start. And when you have that element of engagement and people want to see something happen, I think everyone is really on board. We've actually seen a lot of change over that time. So we've seen a lot of change in the management of lung cancer. So that means we've had to adapt to that. We've seen establishment of an e-bus service here at the hospital, which was game-changing. It meant people could have a diagnosis here that used to go to Melbourne. And now we've got thoracic surgeons here, which is actually for me a little bit sort of still mind-blowing that we have it. We're like a city hospital and we offer robotic surgery. And once again, has meant we've had to change things and the way that we do things to make sure that those patients are ready for surgery. GICS has such a good understanding of the region, and I think for us, the next steps is we have a lot of patients that come really long distances. We're talking border. And it was really interesting. A couple of weeks ago, we did our triage for our clinic, and not one person was from Ballarat. Everyone was from at least 2.5 hours away. And all of those patients bring challenges with them because it's not hard when you're not local. And I think GICS in particular, their connections to the region and understanding of the region, we've got a lot of work to do together in the future to really say how we can make sure that our service captures everyone, and also how we can really help those patients when they come here to Ballarat, but also explore looking at things like satellite clinics or ways that we can actually telehealth, really starting to establish that because I think our population is changing. I think with the National Lung Cancer Screening Program, the data tells us the demographic is probably really a rural demographic that will be coming to us, and we're going to have to be ready to really help and support those patients.